Computers, there I was trying to unmute myself, and it was taking a little bit longer than I expected. Wherever in the globe you may be, a warm welcome to you, and thank you for joining the WHO NTD department for the next in the series of webinars highlighting key themes of what is well, it seems that a number of people lost sound, but I also dropped out. I don't know whether you can hear me now. If somebody could respond, please.
Patricia, it's okay. We can hear you now. There was a blackout on the sound, and I think it was more or less everywhere. So please do as appropriate.
All right. Thank you very much, Ashok. So just as I was saying, I'd like to say a very big congratulations to the entire NTD community for the tremendous and invaluable support and commitment towards the historic achievement of the endorsement of the NTD Roadmap. Allow me to quickly go through the key housekeeping guidelines. To submit questions for the Q&A that follows each panel, kindly use Slido by entering the event code, which is NTD Roadmap. You'll be asked a few poll questions, after which there'll be a prompt to join the session using the Q&A option on the page. All panelists need to remain accessible during their particular session to respond to any questions from attendees. Simultaneous interpretation, of course, is provided in both Spanish and French. For this, look to the bottom of your Zoom screen where you'll find a pop-up bar from which you can select the language of your preference. Please note that panelists need to have interpretation off if they have no need for it, as it can sometimes cause audio interference. Now, I expect many of you will also be posting on social media, so kindly use the hashtags BeatNTDs, NTD Roadmap 2030, and Build Back Better, as well as tagging at WHO on your post. That way we can find you and spread the message even further. As with past webinars, today's discussion will be live streamed on YouTube, but please refrain from turning this on, panelists, as it can cause interference. Last but not least, mute all telephones, please. And if you're not speaking, kindly mute yourself as well to avoid any background disruption or children running in the back or anything like that. Thank you very much. And to the interconnectedness of things, this intricate codependence for optimal survival is at the core of nature. That ecosystems thrive on the well-being of all that lives in them is not lost on us. And even though the scope is wide, the current pandemic has thrust this fact to the forefront of everyday life in a very powerful way. This makes the One Health approach and the global vector control response that we will be discussing today even more timely, more urgent to reach the 2030 NTD Roadmap goals. Now, 3 expert panels will contribute different health perspectives from public, animal, plant, and environmental to discuss how best to optimize these 2 key approaches over the next 100 minutes. So let's set the stage.
Crisis is a good word for what's happening at the moment.
Snakebite is the most neglected of all the so-called neglected tropical diseases.
If we are to save lives or limbs, this is the time for the whole world to wake up.
The world has the capacity to deal with these problems.
Getting this drug is a human right. It's not a matter of economic business.
That's right, snakebite, which is the latest addition to the NTD portfolio, and we'll certainly be touching on it at various points during the course of the webinar. And in an effort to get as much discussion in, allow me to introduce our first panel of experts speaking to One Health. Dr. Keith Sumption, Chief Veterinary Officer of Animal Production and Health Division at FAO. We've also got with us Matthew Stone, Deputy Director General, International Standards and Science at the World Organization for Animal Health. Anand Kumar, Managing Director at Indian Immunologicals Limited. Edmundo Larios as well is joining us, Professor at Universidad Nacional de Rio Negro in Argentina. Wendy Harrison is joining us again, Chief Executive Officer at the SCI Foundation. And we also have, last but not least, Sanjeev Kumar, the head of the Department of Internal Medicine at the BP Koirala Institute of Health Sciences in Nepal. A warm welcome to you all. Let's start off with you, Keith. Okay, so FAO, OIE, and WHO set out to further develop the One Health approach through a strategic collaborative framework built on achieving optimal health outcomes, centering the interconnectedness of ecosystems within it. What has this inter-organizational initiative achieved so far?
Thank you very much. No, it's really a pleasure to be here, and really congratulations to everyone all for the roadmap. I think if we compare where we were 15 years ago, before particularly things like the highly pathogenic avian influenza, then we didn't have programmatic approach taken together with perhaps the good tools that would be needed to guide national agencies working in the veterinary sector, working in the human health sector, and on the environmental side. We didn't have those protocols, guidance that we could utilize to develop national action plans or national One Health platforms. So that's something that is new, and increasingly we see that those are really central to what's being achieved for zoonotic diseases, but also for antimicrobial resistance. An understanding that we really have to work together, and that increasingly we have to include environmental health and the agencies involved in environmental health into those One Health platforms. It cannot just be veterinarians and the medical services talking together. We realize the drivers are much wider. So I think we've achieved bringing people together.
Yeah, no more silos. But how effectively can the tripartite support achieve the roadmap targets?
Well, firstly, to say that the reach of the three organizations, is better together than it is on a single basis. As we know, in the UN agencies, working together at the national level is something that is really required. And we have in FAO something like 130 offices. We have around 400 people working in capacity building in One Health. But that's not going to be enough. We have to really work with WHO, with OIE, and with other agencies to be able to extend it. Because one of the key areas is to leave nobody behind in the search for One Health. It should be One Health for all, not just for those who have those platforms in place.
Yes, thank you so much. Matthew, synergy is key. How can human and animal health sectors collaborate to address the problems posed by neglected zoonotic diseases?
Thanks, Patricia, and thanks to WHO for the invitation, and my congratulations as well for the NTD Roadmap, which lays out a very clear pathway. The clear imperative for me is that the epidemiology of these diseases that are zoonotic diseases, a lot of these NTDs crossing over between animal hosts and humans, demands a clear understanding of the science, a strong evidence-based approach, and then a collaboration between agencies at the global level, which the tripartite is attempting to model. So WHO, FAO, OIE, modeling the sort of collaboration and partnership that we then expect to be driven down regionally into national government, and even in local action. It's incredibly important. Yeah. And just to build on what Keith was talking about before in terms of the tripartite's One Health approach, we've really achieved a lot. And when we look at the three key priorities that were established when the tripartite One Health collaboration was first founded, so animal influenza, zoonotic influenza, rabies, and antimicrobial resistance. So rabies in particular is a really important disease in the NTD roadmap. And we know that despite all the investment in post-exposure prophylaxis for humans, investment in awareness and advocacy around dog bites, the global goal of ending human deaths by dog-mediated rabies by 2030, which is our common strategic goal, it will not be achieved without mass dog vaccination. That is the preventative measure. And the OIE and WHO, for instance, have been collaborating for a very long time to deliver dog vaccinations to countries. So the OIE vaccine bank for rabies has delivered over 25 million doses of vaccine into Africa and Asia. And a great deal of that is a result of the resource mobilization that WHO has done. And so WHO funding going into the OE vaccine bank to deliver these vaccines into the country. So a really great example of the sort of collaboration that we can achieve.
Okay, and it's a good thing you brought up the rabies, of course, which is entirely preventable and is one of the oldest known zoonoses. And there have been global attempts to eliminate it, as you've begun to mention, using the One Health approach. What are some of the key lessons learned from some of these efforts, Matthew?
Well, first of all, very important that at a national level, we achieve political awareness and political prioritization. Okay, so collectively, we've got a drive at the moment to identify priority countries, countries that are poised to make the step change that we need to see, and a drive to achieve political commitment from common ministers, from ministers across animal health, agriculture, human health, environment. Make this a political priority at the national level. And then, of course, you know, the way programs are designed, we know how to do this, but often understanding where are the risk hotspots through good surveillance systems. So surveillance systems that allow us to target mass dog vaccination campaigns, understand where the clusters of infection are, and to hit those hard to achieve that magic 70% of dogs vaccinated in those regions through mass vaccination campaigns. And in doing so, we need effective collaboration between, often there's a big NGO army working to help the implementation of these campaigns. So what we need to see is a collaboration between the international organizations, the national capability at the national government level, and the NGO sector. And towards that, we're just in the process, the tripartite of establishing the Rabies Global Forum, launched a couple of weeks ago on the occasion of World Rabies Day.
That's right, that's right. Now, 2 points, obviously, I'm sure that we're going to be coming back to during the course of this webinar: political awareness and prioritization, and of course, data surveillance systems. Anand, I'm going to move over to you, and just so we can talk a little bit about the pharmaceutical industry, because it plays a crucial role in global health security. How relevant is One Health to the industry that you work in?
Yeah, thank you, Patricia. It's very, very relevant in the sense that even our vision now for Indian Immunologicals Limited is shaping global healthcare by spearheading the One Health initiative. So we have added this One Health word in our vision itself. So we started as a veterinary vaccine company in 1983, and we are doing reasonably well. We make all kinds of vaccines for livestock. We are one of the largest producer of rabies vaccines for companion animals. And somewhere in 1998, we got into making human vaccines. So today we are also one of the largest producer of human rabies vaccine in India and probably in the world as well. Our company makes all kinds of vaccines. We make a lot of vaccines in the One Health space. We make vaccines for brucellosis. We make vaccines for of course, rabies. And we also developed the world's first vaccine for porcine cysticercosis, of course, in collaboration with Galvamed and with the University of Melbourne. So, the industry actually plays a very, very vital role because various tools required in the space, whether it be diagnostics or vaccines, have to come from the industry. And one of the things, especially in the NTD space, is that you need to not only produce quality tools, it also has to be very, very affordable and accessible.
Yeah.
That way, we as a company, we have distribution networks across India, and we try to reach out to every corner of the country. And sometimes it's difficult just by a company itself. So we also have tied up with as contract manufacturers for various other pharma companies, so that we can spread this access to across various corners of our country.
Mm-hmm. Now,
we're having reasonably good success in providing all these tools. The only thing that is of certain concern is that more and more can be done at the animal level than what is actually now being focused at the human level. For example, rabies, we are selling more human rabies vaccine than animal rabies vaccine, though animal rabies vaccine is probably 1/40th the cost of a human rabies vaccine. So,
and it would be great for you to talk to us about that, perhaps. You know, it might seem obvious to many people who are sitting in this, this webinar, but how vaccination protects humans from acquiring diseases. Because, yes, Matthew brought up vaccination and keeping animals healthy. And of course, you've got firsthand experience on how it keeps livestock safe. So talk to us about how it protects humans. Let's go into that direction.
So, like, you're asking how vaccines protect humans?
Yes, from acquiring diseases. Because it talks about the vaccinations for dogs.
It's the single most cost-effective intervention that exists now in the healthcare space. And also now with COVID-19, I think today the word vaccine is so prevalent, and almost every household you hear this word vaccine. So definitely it's created more awareness, and I think definitely if vaccines offer, compared to, like, say, treatment, the cost of treatment is much higher than cost of vaccines. And today in India, like, because we are one of the largest suppliers of human vaccines for the National Immunization Program, and some of the cost of vaccines that we provide are very economical. For example, a pentavalent vaccine, which is used for five major diseases like diphtheria, pertussis, tetanus, hepatitis, and Hib, we are offering at a price of probably 25 cents to the government. So tell me any medical intervention which can protect somebody from 5 diseases with just 25 cents. So
yes, makes all the sense, doesn't it?
It does.
It does. Thank you. Edmundo, through your work in epidemiology, how can we convince investment in animal health to protect both human and animal health? Edmundo's with us, isn't he? I think I saw him earlier.
Sí, aquí estoy. Es una pregunta más que interesante. Yo hablo en español. Y diría que la primera cuestión es entender, nosotros desarrollamos una gran infraestructura en esto, en salud pública, a partir de una enfermedad catastrófica como es la equinococosis, que hacía estragos. Yo estoy en la Patagonia, en nuestra región geográfica. Yo diría que la palabra mágica para lograr convencer a las autoridades se llama visibilidad. Tenemos que darle visibilidad política a la enfermedad. Tenemos que darle visibilidad con la población. Tenemos que vender lo que hacemos, tenemos que vender los éxitos que tenemos, y tenemos que lograr que todos vean la enfermedad y vean la organización que le da sustento a esas estrategias de control. Y en esa visibilidad yo diría que hay dos cosas, dos estrategias importantes. Una es, desde que nosotros empezamos a trabajar en el año 80, ya hace tantos años, si bien las primeras medidas de control eran estrictamente veterinarias, rápidamente montamos, gracias a la Organización Panamericana de la Salud, que nos ayudó mucho, estrategias de búsqueda activa de casos en las personas y tratamientos nuevos, oportunos, para mejorar las perspectivas. Eso hizo que el grupo inicial veterinario empezara a trabajar con un enfoque transversal rápidamente e integrarnos con médicos generalistas, incluso con cirujanos, que son más difíciles de llegar en el sector salud. Y rápidamente empezamos a trabajar con lo que ahora se llama concepto de One Health, y que para nosotros en los 80 y en los 90 y en el 2000 siempre fue todos arriba del botecito. Esto nos resultó muy útil porque rápidamente nuestra estructura de control era una estructura del servicio de salud y no una estructura tradicional veterinaria. De hecho, nosotros hoy tenemos veterinarios en los hospitales, adentro, en todos los hospitales tienen veterinarios en sus plantas. Y el segundo enfoque que nos dio muchísima potencia y nos hizo indispensables para las autoridades políticas fue que, si bien empezamos con un programa vertical, que era el de equinococosis, rápidamente fue mutando y creciendo y multiplicándose, y empezamos a absorber todo. Empezamos a absorber el control de las enfermedades vectoriales, como Chagas, empezamos a absorber el control de la calidad de agua de consumo en las zonas rurales, empezamos a absorber hantavirus cuando nos explotó en la cordillera, y finalmente incorporamos también lo que es inocuidad de alimentos, habilitación de fábricas de la alimentación y esta cuestión de investigación de brotes de enfermedades. Entonces, transformamos lo que era una estructura vertical que hacía un programa, le dimos una lógica de funcionamiento total, y esto nos hizo indispensables para la autoridad sanitaria porque pasamos a resolver no un problema, sino muchísimos problemas. Entonces creo que este enfoque es mucho más moderno y es una de las cosas que nos permitió tener una visibilidad muy grande, y la visibilidad es lo que nos vende.
Thank you. Now, there's much that you've said there that, and I like the word that, I like that you use the word transformation since the 1980s. It's very powerful. And yes, the advocacy is necessary, but what are there any other challenges that you're facing that you'd like to share with us? And Edmundo.
Sí. Bueno, retos hubo, hay y va a haber todos los días. Las estructuras de salud, sobre todo, son modelos médicos hegemónicos en principio. Y las estructuras de organizaciones de servicios de agricultura, en general tienen un enfoque mucho más vinculado a costo-beneficio, y tienen otra mirada. Articular ambas situaciones es bastante difícil, es un reto, porque los objetivos centrales de las instituciones son distintos. Por eso es importante que el grupo que va a trabajar en estas enfermedades asuma estrategias muy amplias para, por un lado, ocupar un espacio dentro de la estructura de salud que tiene un enfoque a veces muy de atención médica, y llevar a que las estructuras vinculadas a la agricultura y la ganadería realmente tengan un enfoque vinculado a la salud, a veces con enfermedades que no generan problemas a la ganadería. Nuestra experiencia con equinococosis es que es muy grave para las personas, y si bien se transmite a partir de animales, no genera un serio problema para la ganadería, por lo que a veces es muy difícil lograr que agricultura y ganadería intervenga, porque pareciera que no es un problema de ellos, si bien hoy día todo el mundo declama, gracias a una salud, la importancia de que todos trabajen en ello. Pero no es fácil llevar a quien tiene que lograr más proteínas y más plata, llevarlo a la inversión en salud. Por eso en algunos temas el que lidera es salud pública, justamente, porque todos estos son problemas de salud. Y realmente son todos clientes nuestros del sistema de salud. O solucionamos el problema con prevención, o los atendemos en la guardia o en el consultorio externo. Y a veces los servicios de agricultura les cuesta más entender esa lógica.
Thank you, Edmundo. Wendy, given your multi-pronged work and experience at the interface of animal and human health, what role do local communities and non-governmental organizations play in implementing One Health?
Perdón,
Wendy?
en las organizaciones no
Sorry, that question was for Wendy.
Sí.
Thank you. Sorry. Hello, and thank you to the WHO for giving the NTD NGO network, which actually the SCI Foundation is part, and who I'm representing today, for this opportunity to participate in this really important event. And thank you, Patricia, for the really interesting question. And I think firstly we need to be really clear of actually differentiating the roles that local communities and NGOs can play, because I think it's really crucial that local communities have absolutely full ownership of One Health interventions, because they, at a really fundamental level, understand the complexity of this interconnectedness between animals, humans, and their shared environment, and the need to maintain health across all three, but also the multiple trade-offs that have to be considered. And an example I really like of this is thinking about free-ranging pigs. So these can scavenge food from the environment, and so therefore they can provide a really cheap source of protein that's essential for good human nutrition. They're also a really valuable asset that can be sold and fund things like family health care. But often these pigs would have access to unprotected latrines. That means that they're at risk of zoonotic infections such as, teniasis and cysticercosis that we've heard about previously, that obviously not only impact the productivity of the animals, but place that really profound burden on human disease. So effective disease control solutions have to take into account all these community level factors. But often these real life solutions that are developed by communities won't align with the sort of current, much more deliverable driven single sector focused funding. And this, I think, is particularly acute in One Health because there's really no enabling framework currently that really allows the kind of costs and the benefits to be appropriately apportioned across the different sectors. And I think the NGO's role sort of at that interface really is threefold. So firstly, to support the communities to communicate their needs to the policymakers and funders through capacity building and education, but also to broker interactions only in instances where the kind of cross-sectoral or the cross-ministerial discussions might be a challenge to initiate. Also to be able to facilitate innovation by supporting communities to identify research gaps and support kind of proof of concept One Health projects. And lastly, to NGOs to support communities to be able to benefit from the globally developed One Health kind of best practice guidance that we've heard about through the likes of the tripartite, by providing that technical assistance to support the adaptation of this guidance in the community context.
And of course we've heard it before, tap into local knowledge, build strong partnerships with communities. You'd heard something about data collection a bit earlier as well. Are there better ways to engage the communities to prevent and control zoonotic diseases and snakebite envenoming to achieve targets of the NTD Roadmap?
Yeah, I mean, I think exactly as you say, we really need to acknowledge that actually successful One Health programs invariably demonstrate that really effective engagement at the community level. And we've heard, examples from rabies, and particularly the importance of having those community participation in surveillance, and there's great evidence from the Philippines that actually that community level active surveillance systems are really able to identify rabies cases in the community, despite the fact that at the conventional systems actually consider those areas to be free of disease. But to improve that engagement, it's really key to make sure that we raise the awareness of principles of One Health and the information flow across all levels that I know a lot of people have already talked about, right from the community up to international agencies. Because it also really allows the broad public health community not only to respond to the outcomes, which obviously here are the zoonotic disease and snakebite, but also the root causes. And by able to have those multi-sector stakeholders together to do joint risk assessment, planning, and the implementation, it really allows that optimization across all sectors and across all levels. But I also think what's really key is actually to support practical collaboration. Really, how do we harness the potential that we all talk about from working across sectors when we actually know that practically it's really challenging? Yes. And so to support this, the NTD NGO network has actually formed a One Health working group, really to try and build within the NGO community a community of practice that really hopes to learn from other cross-sectoral initiatives, but also to recognize some of the areas where the One Health approach will actually require some new thinking to make sure that this practical collaboration occurs. One thing that we're doing is working very closely with the WHO to facilitate the development of a supporting document that will sit alongside the One Health strategy that's referenced within the roadmap, and make sure that doing this we're as participatory as possible, and that we really reach out and engage with new stakeholders from the environmental sector, but also from the animal health, who can advise on approaches to increase program reach and interface with existing veterinary public health programs in the community. Because this kind of engagement and contribution of these cross sector stakeholders is not crucial only for implementing One Health, but also for attaining the roadmap goals.
Always good having you on the webinars, Wendy. Thank you so much for joining us. Sanjeev, it brings the discussion neatly to your experience in Nepal. Sanjeev, and how bed nets, known to protect against mosquito bites, can also be used against snake bites. Tell us about this.
Thank you, Tricia, for the question, and thank you, WHO, for giving this opportunity. To answer your question in one sentence, yes, bed nets should be deployed to protect both mosquito-borne diseases or vector-borne diseases otherwise, and snake bite. Let me bring it to Nepal or any other neighboring country where you could see that vector-borne diseases as well as snake bite has a high burden. And you know that for the vector-borne diseases like Japanese encephalitis, malaria, kala-azar, lymphatic filariasis, the impregnated bed nets confirm or probable gives protection against those diseases. And probably you also know that this human behaviors and activities and presence of snake, these are the determinant of snake bite. And one of the human activity that determines snake bite is a sleeping habit. So if someone sleeps on the floor in the night, they are at the risk because the snake bite, especially the nocturnal snake like crate, who is into the house for the search of food or for the shelters, may come across a human being during sleep, and the crate envenomation occurs. So if we have a common intervention that can prevent this nocturnal snake bite reaching human being as a barrier, or at the same time for the vector-borne diseases, then obviously this will be very useful. And for example, in Nepal, we could demonstrate that the bed net was a strong predictor, protective factor. What I meant to say is a strong protective factor against the snake bite at night. And if the use of the bed net in good condition was significantly better, that means it provided better protection than this, torn out or something like that, bed net in bad condition. So in a nutshell, if intervention to deploy bed nets will definitely provide protection against multiple entities and non-entities. But one thing is that, yeah.
Sorry, I was going to say, and one wonders whether it's possible to apply One Health to prevent snake bites. Can your experience in Nepal teach us anything around that?
Yeah, okay, because I would like to bring you another point that snake bite primarily affects poor farmers, financially poor farmers, workers, and cattle herders, And then because of their economically poor, their living conditions or the settlements occur in such place which is remote in the rural areas. And because of that, because of the economic condition, their housing condition is also similar, like physical characteristics of house, like roof, or you can say non-cemented floor. All these conditions create an environment, and they also keep their grains and the animal foods inside house.
In there
so
as
they
well.
all this creates an environment where the snake can shelter, snake can come in house, and animals are there because they also keep their animal in rural communities, because these rural communities are strongly dependent on the animals for food, for their work, and also direct source of revenue. So all these factors where snakes and human being live together, I think. And we have been looking at this human effect of snake bite, but hardly we look at this effect through the animal health. Like if we took the effect on human as well as effect on the animal, direct effect or indirect effect through loss of livelihood, then the impact will be really higher than what we...
Yes, it would be huge. Yeah.
And,
okay. I'm so sorry to kind of stop you there at this point. It's only because we're so short of time, and I've got to get a few questions in as well for from the audience for you all. One here for Anand Kumar. Do you have a WHO approval for your human vaccine, Anand? It seems like Anand's disappeared.
Yeah, I'm here. We are in the process of getting a WHO. We have engaged an agency called PATH, and we are going through the process of getting ourselves WHO PQ'd.
Good. Wendy, one for you. What are the funding prospects for NGOs and other potential research institutions to work in this emerging field of One Health? Interesting they say emerging field, but yes, Edmunda had said from the 80s it's been there, but it's developed.
Absolutely. I mean, I think that this is actually a real challenge, and an area where we need to focus a lot of our energy in terms of advocacy, because it just is very challenging to be able, as I said, to take that community-based approach for generating solutions, and then have the ability to fund those solutions from existingly quite siloed approaches. So again, I mean, this is something that I think within the NGO community, we see as a key priority for advocacy. Really trying to get the even within the same funding organisation, they often have very significant silos of where their animal health funding and their human health funding comes from. And when there is that flexibility, then obviously you can demonstrate very significant impact. But yeah, I think that's a key priority.
Yeah. A question for Matthew and Keith. Can you elaborate a bit on non-zoonotic NTDs? We know a bit on how One Health can help with zoonotics, but we'd like to hear more on that. Matthew and Keith, who'd like to go first? Non-zoonotic NTDs.
I'm I need a little bit of help with the question, because if they're non-zoonotic NTDs, are we talking about human diseases or animal diseases? And presumably, if the question's directed at us, you're talking about animal diseases.
Yes, I would imagine so. That's how the questions come in.
Well, of course, for the OEE, let me point out that the OEE undertakes a listing process of diseases, and there are, in fact, 117 OEE listed diseases. Now, we don't have strategies and programs for all of these diseases. Of course, we have to focus our efforts and target for the greatest impact. But let me point out something interesting going on at the moment, because making the compelling case for investment in animal disease control and through that recognizing its potential impacts in terms of improvement of public health or improvement in food security or sustainable economic development is absolutely key for us. And sometimes it's very hard to understand where to put the priorities. So the World Health Organization and the public health community over a long period have invested in the global burden of disease, a system that helps understand and attribute impact across human health. We're just embarking on the same journey. We have an intention, and we've formed a partnership with the support of the UK government and the Bill and Melinda Gates Foundation to develop the global burden of animal disease, which will help us understand and attribute amongst all the causes, including, you know, what are really considered quite mundane and prevalent diseases like endoparasites or even ectoparasites, which are huge challenges in many parts of the world, to help us understand and attribute impact and therefore prioritize and build programs. So that's an exciting development for us.
Okay, Keith, you're not going to answer the same question. I've got another question for you, which I'm going to pose now. How can a One Health approach contribute to achieving NTD elimination in countries continuously experiencing potential effects of climate change, such as frequent storms and flooding? Yeah. Keith, question for you.
Thank you. Well, I mean, the whole question of resilience at community and household level is kind of central to almost all of the UN work. It's very central in the work that we need to do in terms of coping mechanisms at the household level, but also the type of services available, including knowledge at each household level to deal with risks as they come up. So definitely, if we're taking more of an all hazards approach, we have to say that that the risks of disease are part of disaster risk reduction. Climate change is obviously making that more likely in some places, but disaster risk reduction is not just about livelihoods in the UN. We're now thinking that it's also about preventing disease that is caused by the environment, caused by the impacts of flooding, like Rift Valley fever can occur after flooding, as well as parasitic diseases. So we need to, in building those resilience programs, we can't just think about the short term. We have to think about the abilities of individuals to be able to understand the risk and then do something at their level with the services that are available to them.
Yeah, that's right. Okay, I need to close off this panel at this point, because as much as we had glitches right at the beginning, I have extended a little bit more than I should have. So thank you to all our panelists for joining us and kickstarting our session today with great insights. Now I'd like to just suggest that we all just take a pause for a minute and remember whom this is all for.
Jariam go kurecho, what is Gapo, that is Jokaya Chol. O Jaban within Gopina Chijawi, Jawi could tell a choke in Pegata. Japin, Yada Takaro. Jawi, Jokono in Doja. Yoru chat, or Jabba.
Nyandeng reminding us all why we do what we do. Now, moving now to focus on how we can work together more efficiently to optimize global vector control responses. Once again, a panel with decades of experience between them to further enrich the discussion. We've got Steve Lindsay, Senior Professor at the Department of Biosciences in Durham University in the UK. Emmanuel Chanda, Regional Entomologist at the WHO Regional Office for Africa. Ashwani Kumar, Director at the Vector Control Research Center, India Council of Medical Research. Li Ching, Director at the Environmental Health Institute in Singapore. And Afif Ben Salah, who is the Vice Dean for Graduate Studies and Research at the Arabian Gulf University in the Kingdom of Bahrain. Steve, let's start with you. In 2017, the GVCR sounded an alarm, over a shortage of entomologists and vector control experts. What's become of this wake up, or what's the outcome of this wake up call now?
Patricia, that's a really good question, thanks. So the basic problem is, as some diseases transmitted by mosquitoes have gone up through the roof, we've seen entomologists disappearing. So in some places they become threatened species. So the GVCR is a wake-up call to look for countries to look at where they can improve and consolidate staff. And so to date, 25 countries have done that around the world, and many more to come in their needs assessment that they're doing. There are courses around the world, particularly with dengue control in Africa. There have been some in Cuba and Singapore. There are masters in Africa, in South Africa, in Sudan, and India, and Pakistan, and then in the US and in the UK, and there are many others. But it's interesting that today we're having this discussion over the internet. And one of, I think, of the successful ways of education is through remotely. And the Global Vector Hub, based at London School, had 4,000 people on their training course on vector control. So there's a new way of doing this, but we can't be complacent about this, because there's a real need for more people, and for building up a career structure as well. And I think one of the things that goes across the NTDs is to make sure that we can continue developing actions against NTDs in the background of the COVID-19 pandemic, which is of course a major distraction to many health departments around the world. And we mustn't lose sight of the importance of NTDs.
Yeah, and of course the focus today is more on keeping the vector out. How can housing improvement contribute to prevent vector-borne diseases? I mean, if you just think about, the rural to urban migration, there's usually inadequate housing that follows that, and then open sanitation, poor hygiene. And, we had Sanjeev also talking about how everything is in one house, under one roof. How can housing improvement contribute to prevent these vector-borne diseases?
So this represents an extraordinary opportunity, particularly as we're building increasing number of houses, and in neglected tropical diseases, we're thinking about dengue and diseases like dengue, chikungunya, Zika, yellow fever, all transmitted by the same mosquito, the same vector, probably in every town and city throughout the tropics and subtropics. So what do we do about that? Well, this is a container breeder. So removal of surface waste is important, because you're going to do this anyhow. Reliable pipe water, so people don't store water, which is a breeding site for these mosquitoes. We can screen houses. We can do more to reduce the force of infection. And when you speak to Li Qing, there have been extraordinary examples of that in Singapore.
Yes.
So there's a lot we can do, and what it really requires is a discussion between vector control experts and those in the built environment, the engineers, the architects, the city planners, to help build out these diseases for the future. This is long-term sustainable control.
Yeah.
We've made great strides over the last 5 or so years working with WHO and UN Habitat to try and get that fusion at the international level, but also to work down and to do it at city level as well. And there's enormous opportunity for doing better.
Okay, thank you so much there. Steve, Emmanuel, I'm going to turn to you. The burden of most of the diseases is on the African continent, and countries in the WHO's African region have proven experience in implementing integrated vector management. How do you implement GVCR for control of malaria together with arboviral diseases on the continent?
Thank you very much, Patricia, for that very important and pertinent question. Yeah, in WHO Afro, we are working closely with member states. And in this regard, we are helping member states by providing them with technical support in adapting and implementing normative guidance that is pertinent to vector control. And in 2019, a framework for the implementation of the global vector control response was developed and endorsed by the ministers of health from member states. And in implementing this framework, we are helping member states to actually contextualize the key actions proposed in the global vector control response, and particularly countries presently conducting vector control needs assessments to appraise the vector-borne disease situation, as well as policy and structural frameworks. They are also implementing and updating, as well as revising their integrated vector management strategies, coupling them with insecticide resistance management plans, all in line with the global vector control response. And to add on to that, they are also developing strategic plans for advocacy to increase communication. And all these efforts actually are facilitating resource mobilization, as well as heartening policy and political will as well. But we are helping countries and working closely with them again in making sure that we strengthen vector control and multi-sectoral workforce. And this, we are doing this particularly by making sure that the entire continuum of partners and stakeholders, starting from funders, policymakers, implementers, and communities are involved. Countries in this regard are actually busy trying to establish multi-sectoral as well as interministerial kind of workforces through vector control working groups, others are calling them steering committees. And in this effort, they are making sure that the environmental sector, the agricultural sector, is brought on board, including academia and research, as well as other pertinent stakeholders that have vested interest in vector control. We are working and collaborating closely with regional associations like PAMCA. We are working closely with ALMA. We are working closely also with regional economic communities.
Sorry, if I could just stop you there a minute. There's a very disturbing sound coming in. I don't know where it was coming in from. If other panelists could just mute themselves, just to make sure that there isn't any background noise filtering in. Emmanuel, obviously, there's a lot going on there in the, generally in the WHO African region. But let's also now listen to what's going on in India, which has rich experience in implementing integrated management, particularly around how to help other countries to address multiple vector-borne diseases, both with and without animal reservoirs. Ashwani, you're there as well somewhere. Ashwani Kumar. You may have lost him. If you could unmute, Dr. Ashwani, I could see you there. There you are. We can't hear you, Dr. Ashwani. Unmute. I think we'll come back to him. Lee, Dr. Ashwani, we'll come back to you shortly. Lee, high numbers of dengue recorded this year, and Singapore has shifted to high gear, put money where it's needed, and is testing innovative dengue control tools. Is there anything you are studying currently that other countries can benefit from?
You mean from the study, right? Our Project Wolbachia? Yes, so Singapore has been, we have been struggling with the dengue burden challenge for decades. Since the 60s, we have put in place a dengue control program, which relies on vector control. So I guess similar to the lack of entomology, there's also entomologists. There's also very little development in the field of entomology. So we're actually very glad to have made progress in Project Wolbachia, which is a new novel tool. I do hear a lot of echo. Are you okay?
That's correct. I'm also hearing the echo. Ashok, can you hear an echo? Just give me a minute.
Yes, we do. We're trying to sort this out.
You're trying to sort it out? Okay. What I'd suggest, Lee, is just speak very slowly.
Yeah. Okay,
so that we can catch your words.
I'll try, yeah. Okay, so from Project Wolbachia, because it is a new tool, totally new, we're very glad to have it, to be able to trial it. So one very important aspect that I've learned is the phase approach, taking a phase step-by-step approach and starting with risk assessment, very thorough risk assessment, understanding the potential impact, not just on the disease itself, on the mosquito population, but any potential secondary impact, like on the ecology. So after doing that, we knew we were comfortable, and then we went on to small field trial, a small area. Subsequently, progressively, we enlarged the area in a phase approach. Each phase with very defined objective. We know what we want, and only when one phase succeeds, you go to the next phase. Okay, I'm still hearing an echo.
Yes, I can still. But since you are in the Ministry of... Sorry, but since you are in the Ministry of Environment...
And Project Wolbachia and all these new tools is...
Give me a minute, Lee. Since you're in the Ministry of Environment, how do you link up with the Ministry of Health and other partners to control dengue? I mean, I like the way you're saying the phased approach, and you bring in people. How did you link people up, to be able to control?
So in fact, Dr. Keith just now mentioned that we should bring in more environmental sector in, and in fact, in Singapore, vector control, which is meant for controlling vector-borne diseases, has always been in the environmental sector.
Yeah.
So the importance of environment has been integrated into the system. Under Ministry of Environment, we have the WASH, the Water Agency, and the Sanitation and Hygiene are also under the ministry, under our agency. So, in fact, understanding the environmental impact, environmental factors has been integral in our system for decades. So in general, for disease, we have a One Health platform. So the core partners are Ministry of Health, of course, Environment, Food Agency, and Parks, Park Agency, Nature and Parks, and the Water Agency. So together, this form, so our One Health has gone beyond just animal and health, but in fact, it has gone across to Water Agency and Environment Agency as well.
Fantastic.
So for dengue control, as Steve mentioned, it's very important because it's urban. The Aedes aegypti is an urban container breeder. So two very important aspects is for controlling dengue. Number one is infrastructure, and number two is human behavior, which means that agencies and associations that has impact on this two will be very critical for us, will be essential for us to control dengue. And this includes the building authority,
yeah,
and the People's Association. So they play key roles in our control of dengue.
Yes, and of course you keep referring to Steve, but both of you are also
I'm still getting a lot of
the
echo, so I don't know what you're hearing.
we do. I actually can hear you. Ooh. Thank you very much, Lee. I know yourself and Steve are on the WHO NTD Strategic Advisory Group. So thank you so much for, sharing giving us some of the, what's going on in Singapore as well with the Wolbachia project. I'm going to try and go back to Ashwani so that we can also get to hear how India is implementing GVCR. Ashwani, are you there? And are you unmuted?
Yeah, I'm there.
Good.
I was struggling with my cursor, which finally got sorted out.
Good. Tell us how India is implementing GVCR.
Oh, yeah. First of all, my sincere compliments to bring these two approaches together of optimizing the NTD, One Health program with the, and this is a very interesting concept because we are now going back to from where we started of ecosystem approach, wherein the different players are being talked about, and we are now respecting the nature, as one of the panelists said, more than ever before. And I think we are compelled to do that because traditionally we relied heavily upon a single approach of using insecticides to control vectors, and there were setbacks. There were of course gains. There was strong progress. In some countries we could eliminate diseases like malaria, but in others have become resistant, and they are resilient and they know how to survive. And there were setbacks after setbacks, and then we came up with this concept of integrated vector management. And in India, interestingly, about 30 years back, 1985, 35 years back, two mission mode projects were started at the national level by the Indian Conservation Research, and two of its institutes, the Malaria Research Center and the Vector Control Research Center. They were, they made a huge strides in implementing the integrated vector approach by opening 13 centers in different epidemiological zones of the country. And various technologies were integrated and tested together. And the outcome was very interesting. In some of the settings, these integrated vector management strategies were working. In other settings, because the diseases are local and focal, they were not as promising. But there were several lessons in the process. So I believe the global vector control response, which is now globally accepted, very, very, very well crafted by WHO in 2017, based on the real ground reality of diminishing manpower, as Steve said, entomologists.
Yeah.
And there are several spin-offs of this very nice programs at a time.
Yeah.
And we were vanishing tribe. Actually, we are really a vanishing tribe.
Okay. Sorry, we've got so many questions already coming in. I'm going to stop you there so that we can get a quick word in as well from Afif before we go to Q&A. At the moment, Ashwani. Afif, given your vast experience in public health, how can we simultaneously use One Health and vector control in settings where zoonotic vector-borne diseases are endemic?
Well, thank you very much. This is a difficult question, actually.
I will give you 2 minutes.
Well, I can give you just one advice.
Yes.
Don't simplify the problem. It's a complex problem. We have to adopt really a holistic approach in understanding the different facets of the problem under study. Because the problem and its determinants, zoonotic diseases, we are dealing with complex systems involving vectors, reservoir hosts, human behavior, and environment. And they are all interacting together. So to optimize any control option, including vector control, we have to understand on the most appropriate ways the different facets of the problem using the best evidence available and understanding to the best context. So the science is very important, and also the context, because the social, cultural, behavioral, epidemiological, environmental contexts make big difference in terms of situation analysis and appropriate approaches and ways to use control options. Even for vector control, there is no recipe. We have to adapt the recipes to the context, to the community characteristics, and to the environmental characteristics. What might work in a setting might not be applied in other settings. So this is the first lesson that I got. Life is not easy. Our life is not easy. We are dealing with complexity. And it takes a long time to find the right solutions. There are no recipes, no easy solutions.
Yeah.
You will not find them in the books or in the journals. You have to go to the field and to assess the situation and to work with a multidisciplinary team. So you have to learn from your discipline will be enriched much more from other disciplines than from your own discipline. So you have to gather multiple specialists from multiple disciplines and let them analyze together the problem and talk the same language and reach an agreement. And this is not easy. Second is to reach this kind of consensus or agreement with the community at the most decentralized part where the problem is really taking place. Because so the first problem is this vertical approach is very bad. Second is decentralized approach is also will not allow you to solve the problems, and you will never achieve sustainable solutions. Because if you don't talk the same language with the community, if you don't meet their expectations and need appropriately, they will not own the solutions. So ownership, we have to deal with the most decentralized layer where the problem is taking place. This is the second lesson. And finally, integration. We have to integrate to optimize all the solutions, and we have to take this opportunity to decentralize, to build capacities, to strengthen the health system, and to decentralize even capacities, lab capacities, and even research. capacities at the most peripheral level. So these are few lessons that I gained through my 30 years experience of fighting zoonotic diseases, and it's really a pleasant to work with entomologists, this species that is at high risk now, because yeah, with the scientists like Bob Kelly-Kendrick, Professor Manter, and others from the London School, and precious really assets. We learned a lot from them, but I think we learned the most lessons that we learned are from the field and the community at the most peripheral level.
Yeah. Thank you. Valuable, very invaluable input there. Thank you so much, Afif. Let's get to some questions. I have one here for you, Lee. What practical recommendations would you give to integrate the work between the Ministry of Health, Ministry of Environment, and other institutions, such as the Ministry of Agriculture, Livestock, and academia at national level? Afif looks like he's ready to answer that question, but Dr. Lee, this is for you.
Okay, so one thing that we have done is formalize a platform what's what we call One Health platform, and we have regular meetings in this platform. So comprising exactly the agencies that you refer to. And this platform also have very close connection with a lot of projects among them. So you form project groups, we develop protocols that we could, in case this happens, what do you do? And, action item. So when teams come together to work, they get to know one another. And when you really need one another, we're there for one another. So, and also through research, then we would connect with institutions like the universities and the polytechnics, where so that kind of relationship we built through a lot through research during peacetime. So I would say it's important to make connections, to form a network among the relevant agencies, and through very deliberate formation of project works and platforms. So we meet regularly to discuss and to bring project forward, finding gaps, and then identify gaps and try to fill in with the project work.
Yeah. Steve, a question for you. In terms of diagnostics, is it possible, or how feasible is it to create a unified diagnostic tool or test that can be used in humans, animals, and the environment, either for active case detection or surveillance?
Oh, that's an easy question, isn't it?
Isn't it?
I have to sharpen it down to which diseases you're interested in. It's, I guess, the case of COVID, where you have tests for looking at it in people, but also in the environment and in stools, is a way to go. And there are technologies being developed that can do this for various diseases, but you've got to be more particularly focused on what you're interested in looking at.
Okay, thank you for that. Emmanuel, question for you. How, the question hasn't come through very clearly, but I will try and make sense of it. How they will apply how will they apply the GVCR to the Anopheles stevenensis? Oh goodness, I'm getting it all wrong now. Stephensii. Thank you. Stephensii mosquito invasion of the Horn of Africa. Yes, in Djibouti and in Ethiopia. How will you apply the GVCR to this?
So, sorry, Patricia, I lost the other part of the question. I just heard.
So how will you apply the GVCR to the urban migration of the mosquito invasion of the Horn of Africa in Djibouti and in Ethiopia, the Anopheles stephensii? Did I say that correctly? I hope so.
Yes. Yes. So if I got the question clearly, the participant is asking how we are going to apply the GVCR.
Yes.
against Anopheles tifensi in the Horn of Africa. Is that clear?
Yes, that's
correct. Great. So presently, WHO is undertaking efforts to ensure that the invasion of Anopheles tifensi in the Horn of Africa is really dealt with urgently. We all understand to say the GVCR is increasing the uptake of integrated vector management. And this intervention has been taken up by most African countries. But specifically for tifensi, it is one species that we know to say it proliferates in urban areas, and as such, we are going to ensure that implementation of what are considered right now to be supplementary interventions for other key vectors of malaria, like larval source management, are implemented where feasible. But again, there should be a lot of enhanced community engagement if we are to win to emerge victorious in these efforts, because the community involvement is going to be key in the implementation of larval source management, and ensure that all the breeding sites are taken care of. But of course, that does not disregard the use of other key interventions like endoresidual spraying, for example. That is going to be enhanced as well.
Thank you so much there. We have to stop there with the questions, again, running out of time. To our esteemed panelists for the invaluable input to the discussion, thank you very much. Let's have a short visual break to take a look at Singapore's Project Wolbachia that Lee, of course, had mentioned before we dive into our next panel session.
Project Wolbachia Singapore involves the release of male Wolbachia Aedes aegypti mosquitoes to suppress the urban Aedes aegypti mosquito population. When a male Wolbachia Aedes aegypti mosquito mates with a female urban Aedes aegypti mosquito that does not carry Wolbachia, their eggs do not hatch and there will be no offspring. Regular releases have reduced the dengue mosquito population by up to 90% and have sustained it at a low level at the study sites. The project is made possible with strong support from the community.
Dramatic results being recorded there, and the ever crucial community participation being key to its success at study sites. Now let's talk more about how an integrated approach to programmatic work helps to achieve the global target of 90% reduction in people requiring interventions as stated on the roadmap. For this, I'd like to welcome our next panelists. We have Daniel Eibach, Senior Policy Advisor, One Health Division of Pandemic Prevention at the German Federal Ministry for Economic Cooperation and Development. We've got Lord Alexander Trees, Emeritus Professor, Veterinary Parasitology, crossbench member of the House of Lords in the UK. Also with us, Victoria Goodfellow, Executive Director, the Lions Head Global Partners, and Dr. Mwele Malichela is also joining us for this discussion. And of course, we know her as the director of the WHO Department of Control of Neglected Tropical Diseases. Welcome to you all. Daniel, Germany has strongly advocated for One Health. How is your government envisaging to further address the rapid expansion of vector-borne diseases globally, and of course, within Europe.
Thank you very much, and thanks the organizers for putting this very nice event together. So to your question, I cannot really speak on behalf of the German government, but for the Federal Ministry for Economic Cooperations and Development. And yeah, I would like to highlight why this One Health approach is actually so important to us for fighting vector-borne diseases, but also NTDs and other infectious diseases. We all know that nearly 75% of emerging or newly emerging human infectious diseases originated in animals. And what we should not forget is that livestock farming is of real high importance for the rural populations worldwide and contributes to the livelihood of around 70% of the world's 1.4 billion people live in poverty. So with this growing world population, the climate change, increasing mobility, and the human expansion into like untouched habitats, the risk of newly emerging pathogens and spillover of pathogens and also vector-borne diseases from animals to humans is likely to increase. And I think COVID-19 is giving us a perfect example. And another thing what we should not forget, which is also highly related to close human-animal contact, is antimicrobial resistance, of course. So what is our approach as a ministry here in Germany? I think we've recognized this very close connection between healthy people, healthy animals, healthy environment. Mm-hmm. And what we created is a new directorate of global health, pandemic prevention, and One Health. Just this year, on 1st of August, it was started. And so this One Health approach is actually institutionalized in our ministry right now. And what we want to do within this new One Health unit is mainly address 4 objectives. We want to incorporate One Health approach in the coordination with other federal ministries, mm-hmm. and within the German German Development Corporation, to strengthen the cooperation with regional and national institutions, and especially international organizations like OIE, FAO, and WHO, mm-hmm. within the tripartite. And we want to promote capacity building and develop One Health as a holistic and cost-sectoral approach to international mm-hmm. development cooperations. Mm-hmm. So maybe I can give 2 examples of what we have achieved so far. It's very, it's a very young initiative now, but
yes,
a few projects
that would be great. Yeah, that would be great. Very briefly, yes.
Yeah. So yeah, we have funded a One Health center in Africa, which is called Orica, in Nairobi, Kenya. International Livestock Research Institute. It's just 22nd of October. Okay. And we also launched International Alliance to address health risk posed by wildlife trade, together with WWF, WCS, and the Frankfurt Zoological Society, just to give 2 examples.
Brilliant. Thank you. Thank you very much for that, Daniel. Lord Trees, COVID has brought to the fore the importance of One Health and the need to address zoonosis. How can we build on this enhanced awareness to fight zoonotic NTDs? And to what extent does the One Health vector control approach ensure the sustainability of NTD programs? Sorry, so 2-pronged question coming at you there.
Yeah, okay. Thank you, Patricia, and thank you very much for the invitation to speak. As a vet who worked for 30 years in the University of Liverpool in the Faculty of Veterinary Science, but most of that time in the Liverpool School of Tropical Medicine, my One Health runs through my veins, so it's a pleasure to talk about this meeting. To me, One Health is about communication, collaboration, and complementarity, and that's really important, and I'll come back to that in a minute. It also, though, to me, it is a means to an end, not an end in itself, and I think we need to bear that in mind. It's a tool to enable us to reach the goals we set to solve real life problems. And I just want to say that the UK is very committed to One Health, and there's a huge amount of initiatives are being launched to deal with that. I would just say a structural change, which is very relevant, I think, in recent years, was bringing together the various research councils, which are the vehicles to support public funding of scientific research, were brought under one umbrella. of the UKRI with innovation. And I think that's a structural way of bringing together medical scientists, veterinary scientists, environmental scientists, and indeed the social scientists and the anthropologists and the economists, which are all very important in solving these problems. The new roadmap, 2021 to 2030, WHO NTD Roadmap, marks a strategic change in direction. It marks a departure from single issue approaches, project-driven, to a more integrated approach to strengthen health systems, and to bring in cross-disciplinarity, which is, of course, the essence of One Health, the communications, collaboration, and complementarity I mentioned earlier. Yeah. So we've got a roadmap now, but what we need are the vehicles to negotiate those roads on that map. We need the processes and the structures to deliver high levels of cooperation at both local level and at national and international level, and to deliver the interventions and the surveillance, but also the funding. And I think there needs to be both bottom-up and top-down approaches. It's essential, as we've heard earlier from several speakers, that local communities are engaged. They know best their local needs. They know best how to integrate different approaches to deal with the myriad of problems they're faced with in local communities. But I think we also do need a top-down approach, and Daniel has just mentioned what Germany is doing. One of the problems we have is that governments, national governments of all shades, divide their activities into ministries and departments with their own budgets. And they don't come together until a very high level, at cabinet level. And it's very difficult as a result to get adequate attention, political focus, and financing for problems that cross those departmental boundaries. And we've heard mention of that with respect to rabies and echinococcosis earlier, particularly where altruism is needed. For rabies, with which I'm involved, we need to vaccinate dogs to prevent human rabies. But ministries of health don't see why they should fund vaccinating dogs, and departments of agriculture don't see why they should spend money doing something that is of purely public health benefit. So I think we need linkages right at the top level of government between different ministries to enable that altruistic thinking, and that there is a share of budgets at least appropriate for that altruistic usage. And there needs also to be, finally, I would say, with regard to integration, the NGOs, and we've heard a bit about NGOs from Wendy Harrison, but NGOs as well, which do magnificent work. I think there is a need there to coordinate their activities to make sure there aren't gaps, but there isn't overlapping activity as well, complementarity, collaboration and communication again. But the remarks about financing perhaps do nicely lead you to your next speaker, Victoria, and the innovative financing, perhaps, mechanisms, not only at government level, but in terms of financial institutions that will enable us to achieve the goals we need.
Yeah. You're leading right into it, Victoria. Lord Tree started the question for you. Your work is around the design and the execution of financing solutions in emerging markets, focusing on sustainable development, a key tenet in One Health, making best use when faced with limited resources. So it'd be good to hear what type of innovative financing mechanism can sustain programs against neglected zoonotic diseases.
Thank you indeed. And we have been sort of putting our brains to work specifically on rabies and One Health recently with the tripartite, with the help of World Animal Protection, and Lord Trees has been very supportive. So delighted to be here talking about this. I mean, when we think about the common themes that run through the financing challenges in NTD, you know, we hear there's not enough money, but even the money there is enough. to enable sufficient planning and continuity of programmatic work to sustain any gains that are made. And that can really undermine, I think, the sense that success is achievable in some of these areas. I think there's a few different things that, that financing can do to try and address some of these challenges. I mean, one, I would say, just having a common funding mechanism can be quite powerful, and this is not innovative in itself, right? But I think actually just having a unified source of funds that can actually enable much greater coordination of programmatic activities, sharing best practice programmatically, and then crucially, facilitating cross-border cooperation, which is often really critical and can undermine the success of some programs. We similarly, in the past, often NTD programs have operated in quite a siloed fashion, although this is changing. But I think as the world moves on and we understand the need really for a much more kind of health system strengthening approach to this, unifying efforts across a whole range of diseases can bring efficiencies, as we heard earlier. So we have been exploring this in the context of rabies, but we see rabies very much as a test case for a larger One Health financing approach, with rabies really having the power of demonstration to show how you can bring these sectors together quite effectively. A couple of other points quickly. I mean, one, for elimination challenges, often you need a surge of money for either mass drug administration or vaccination, and the capital markets can play a role here. Gavi have done this very successfully with their IFIM, where they take long-term sovereign donor pledges and then front-load these by issuing bonds that they can then spend today. And this was leveraged this year for CEPI for their COVID vaccine financing. So I think this can actually address that mismatch between donor budgets and timescales and programmatic needs. Thirdly, I'd say that disease control and elimination is clearly highly dependent on surveillance. So there's been a lot of effort and investment, and that continues to be a focus around the data required. But this can really lead to providing the foundations to consider outcomes-based funding approaches. This may not be appropriate for every single situation, and you do need to be quite careful about, not going down the rabbit hole of setting up sort of very expensive small-scale vehicles that can't be shared elsewhere. But I think there is potential here for actually to use incentives and outcome-based financing to really direct money to where it will be most effective. And I think finally, we heard from Matthew Stone and others have mentioned that domestic government buy-in is key. And yes, part of this is political leadership, but there is clearly a need for any financial structure or innovation in this space to really create a pathway for domestic government participation, even if that's small to begin with, and that can scale over time. And for example, even it's not impossible to imagine down the road, persuading domestic governments to potentially be one of a group of outcome payers, potentially, if they can see the value of programs put in place and they're not at risk of the program's success. So I think that can lead to a path for sustainability in terms of transfer also to government ownership down the road. But I think, the final point I would say is that, innovative financing is just a tool. It doesn't really change the fact that some areas will continue to need significant donor support. And this can really just help shape that and try and kind of put the frameworks in place to make that sustainable and go to the right places.
Yeah, that's right. Thank you so much. Dr. Mwele, let me come to you now. But first, of course, congratulations are in order to you and your team, Dr. Mwele, for the collaborative vision. And of course, now it's all about the coordination of delivering results, the communication, collaboration, and complementarity, as Lord Trees said. Now, your department has several vector-borne diseases, 12 or 13, and the WHO website states that 80% of the world's population is at risk of one or more vector-borne diseases, and many are preventable. How do you envisage GVCR supporting the newly endorsed roadmap?
You're muted, Marwa.
It's like this is the nightmare of Zoom, the constant forgetting to unmute. So thank you, Patricia, as always, and it's a pleasure to be with you as a part of this wonderful panel today. And this is the first time we're gathering since the endorsement of the new roadmap. I want to thank you for the thank all for the congratulatory messages. We know that the roadmap was endorsed at the 73rd resumed World Health Assembly last week, and we should all be proud that of the fact that in less than 6 weeks we'll kick off this new ambitious and challenging vision for the next 10 years. And you know, it's challenging, but at the end of the day, if we're to end suffering for more than 1.5 billion of the poorest people on the planet, this is it's really a key thing to do. So you talked about, you know, how do we get global vector control and One Health? How do we get that operational? And I think the key here, you know, is exactly what you said: collaboration, coordination, and complementarity. And so, you know, achieving the 2030 roadmap goals will only be possible if there's collaboration and coordination across sectors with a strong country ownership. And, you know, a lot of people kind of speak about the model of country coordination of HIV. And I think that there's something to learn from that, from the country coordination mechanisms, which went across the boundaries, you know, it wasn't only health. And I think many people today have spoken that, you know, NTD, these zoonotic NTDs, they're at the interface of humans, their domestic animals, wildlife, their surrounding environments, and can only be addressed through an ecosystem approach. And so we will definitely need to have better collaborative mechanisms globally. And I think that's already happening, but better coordination mechanisms locally, because at the end of the day, context matters. And whatever we say at global level, for this delivery to happen and for this, the vector control response to be implemented well, there has to be good country ownership and local community pushing of these interventions for them to actually make sense. And I think, you know, engaging more people in the environment, that was mentioned a lot today, engaging more people who are working in building and talking about, Steve mentioned building out mosquitoes. I mean, that's a really important part of how we move forward, and looking at these NTDs as really as a development issue more than as a health issue. And I think this, you know, bringing together all these groups, at the end of the day, the collaboration is what will allow us to move from paper to action, in the roadmap.
Yeah. A question here for you, Lord Trees. How can the rabies model contribute to building One Health networks or innovative financing for other zoonoses or NTDs?
Well, I think there are a number of ways. One is delivery. I mean, if you've got teams going into hard to reach communities to deliver dog vaccination, you could deliver other healthcare interventions for the dogs to start with, and oral tablets for echinococcosis, for example, could be dealt with. But you could also deliver other interventions to those hard-to-reach communities. So ivermectin distribution for onchocerciasis, or praziquantel distribution for schistosomiasis, or whatever. The combinations will vary depending on the geography and the particular environment. But there are almost certainly going to be a number of different interventions that could be combined seasonally, in a very cost-effective, synergistic manner. And then surveillance as well. Again, one could set up surveillance platforms which could deal with a number of different health problems that are occurring in those communities. And then in terms of finance, Victoria's talked about how there are generic financial instruments that could be used to help financially deliver a variety of different disease control methods.
Yeah. Thank you for that. A quick question for you, Daniel. Well, it's a long question. Let's see if you can answer it quickly enough. There is likely to be significant focus and resources available from countries on One Health. From the perspective of pandemic preparedness, how do we position NTDs within the pandemic preparedness agenda, as that is the lens this may likely be approached?
Thank you. Yeah, that's a very good question. Yeah, and that's very true. And this is also why One Health is at the moment here in the Ministry, One Health and Pandemic Preparedness are combined in one unit. And I actually don't like the approach that kind of One Health is at the moment very much, or sometimes at least, reduced to COVID-19. But I think, yeah, we need to keep One Health on the political agenda constantly. So it's not just financed through pandemic preparedness sources, but also that, we keep it on the agenda, and that it's more than just pandemic preparedness. I think that's the most important.
Okay, thank you, Daniel. Dr. Mwele, I'd like to just invite you back here before we wrap. I think we've got less than 3 minutes. Yes, for your wrap, because you'd like to do a wrap up here. Thank you.
Thank you very much, Patricia. And I think I mentioned most of the points in my earlier question. I just feel that at the end of the day, we really have to focus on collaboration. But in these times of COVID-19, with the growing attention to zoonosis, and my colleague has just spoken saying, you know, we shouldn't reduce this to One Health to COVID-19. But like was said earlier in this same panel, that it is a tool, and I think, you know, we at the end of the day, we cannot afford to ignore and neglect the suffering that's caused by zoonotic NTDs, by snakebite envenoming, and by vector-borne NTDs, and especially the arboviral diseases. And we have a great opportunity here through, as I said earlier, and has been said before, through collaboration and cooperation and strengthening country ownership. And I think the roadmap really, with its shifts, really embodies what One Health is talking about and what we need, and both One Health and GVCR, in terms of that we do need collaboration, we do need integration, we do need strong multisectoral action. And at the end of the day, finally, we do need strong community ownership of these programs and of the solutions as well. Because, you know, the local homebred solutions are most of the times the best, as was mentioned by Wendy. So I'd like us to, you know, to take this road as we move forward, take these shifts of the roadmap, and know that we can move from paper to practice through the roadmap and through these tools of One Health and GVCR. If we take them as tools, we will be able to actually do a lot more and move forward quickly in this area. And yes, so thank you very much, Patricia.
Thank you. Strong contributions all through the different aspects of the discussion today. So once again, a big thank you to all our panelists for sharing their expertise and of course of their time. Likewise to all the participants as well who joined us, sending questions, comments, listening in and learning. Join us again on December 2nd, when the topic of discussion will be centered on partnerships, essential for the NTD Roadmap success. So looking forward to engaging with you all then. Details of this, of course, will appear on the screen shortly. And as we wrap the webinar, we'll leave you with a brief snapshot illustrating just how country ownership, in this case Mexico, can lead to eliminating one of the oldest diseases known to man. Stay safe and stay well. Bye-bye.
What if I told you we could eliminate one of the oldest diseases known to humankind? A disease that still kills a person every 9 minutes. We can prevent rabies by vaccinating dogs, by washing dog bite wounds thoroughly with soap and water, and by immediately seeking medical care after a dog bite. No child should die of rabies or be orphaned by the disease. No family should suffer from rabies. To end human deaths from rabies, our time to act is now.